Thank you, Tyler. She was planning to spend her entire career taking care of the elderly and others in need of skilled nursing and rehabilitation. But the former director of social work at a local nursing home tells CBS 6 that changed when she was assaulted at work by a patient and she couldn't do anything to defend herself.
Tonight, a Problem Solvers investigation into what some are calling a broken system. Melissa Hippolyte examines the rules that dictate how nursing home staff should handle violent attacks and why police and prosecutors say in many cases they cannot pursue charges.
Well, this concerns an incident that took place inside the Colonial Heights Rehabilitation and Nursing Center. The former director of social work there recently sat down with CBS 6 to detail what she says was a frightening assault. She says she was the victim and the attacker was a patient, but she claims she was powerless to adequately defend herself or hold the suspect accountable.
When she was at the hospital, her last words to her son was, "Tell Cassie I love her." And then she passed.
Cassie Ortiz gets emotional when talking about the patients she grew close with while working at a nursing home.
It's hard for me to leave something that I absolutely love.
She was even finishing up her MBA so she could be a nursing home administrator. Then she had a change of heart.
I will never pursue it at this point.
All because of a frightening attack inside the Colonial Heights Rehabilitation and Nursing Center, where she worked as the director of social work.
And this incident caused you not to pursue your
Yes.
dream of becoming an administrator?
Correct. Because nothing was done for me.
On September 13th of 2022, Ortiz was called to help with a patient who was yelling at other residents. While trying to calm him down, she says he exposed himself, then tried to sexually assault her.
He had my jean jacket completely with one hand and his hand on my neck, pushing me down. I kept asking the patient to let me go. He said no, that I needed to perform oral sex on him, and he just would not let me go. So I was very scared.
Ortiz says she was also kicked and punched by the patient.
I would have loved to have done something, but I couldn't. My hands were tied because we're not allowed to touch the patients. So
you were not allowed to fight back?
No. We're not allowed to touch the patients at all if they assault us.
Ortiz says another social worker finally helped her escape. Once free, she went down to the magistrate's office to take out an emergency custody order. ECOs allow law enforcement to apprehend a person experiencing a mental health crisis and transport them to a hospital for treatment.
He was taken to the hospital, evaluated, and they sent him right back because he was no longer acting out. No one asked me if I was okay. No one asked me if I needed counseling. No one asked me if gave me time off. It was awful. Okay, you just got to go back to work the next day.
On top of that, Ortiz says she was repeatedly asked to intervene and stop this patient's behavior.
I just didn't do it.
Ortiz ended up reporting the assault to Colonial Heights Police, who investigated and consulted with prosecutors. But Commonwealth's attorney Greg Collins says he could not pursue the case because of the patient's mental state at the time of the attack.
People at the facility, even at that time, said that they believed he was having a mental health crisis. And so for my office to prosecute people with mental health crisis is not something that the General Assembly or the populace really wants us to do.
Colonial Heights Rehabilitation and Nursing Center provides short-term rehab and long-term care. Ortiz says when she was there were more than 20 psych patients living on site.
Our job is to not manage psychiatric patients. We're not equipped to do that.
We submitted a public records request to the police department for 911 calls from the facility over the past year and found there were 18 assault calls to police, 2 abuse calls, and 4 sex offense calls.
There's no accountability. I mean, the police can't do anything, administrators can't do anything. We can't defend ourselves.
Ortiz says the facility accepts patients with behavioral issues because their ownership company, Innovative Healthcare Management, wants to ensure as many beds as possible are full.
So it's all about the money. It has nothing to do with the patients and the care that they're getting.
Is it big business?
It's a big business.
CBS 6 has tried to reach out to various people affiliated with the facility multiple times to find out what they're doing to keep staff and patients safe, but we haven't heard back.
I even went to the facility myself, and a staff member we spoke to said she would pass my number along to someone from corporate, but I haven't heard from anyone.
And we're not doing a good job of taking care of our mentally ill in the United States at this point. Every facility that deals with people who have mental health issues needs to get training and making sure their staff is safe and their fellow coworkers are safe.
We looked up the Colonial Heights Rehabilitation and Nursing Center on the Medicare.gov website. It has an overall rating of just 1 out of 5 stars, which means it's rated much below average. Cassie Ortiz told me part of the problem here is that the state psychiatric hospitals do not have enough beds and they are always full. So she said nursing homes are becoming de facto residences for a lot of elderly people with serious psychiatric issues. I'm Melissa Hippolyte for CBS 6.